It is said that vascular health is crucial in old age. To prevent common diseases such as hypertension, diabetes, hyperlipidemia, and stroke, it is important to understand the metabolic processes of the body. Food and water we consume pass through a 9-meter-long tube connected to the stomach, small intestine, large intestine, and anus, eventually exiting as feces. Nutrients absorbed during the passage of food through the intestines are sent to the liver, where they are converted into glucose. Glucose travels through the bloodstream to enter muscle cells. Glucose cannot enter cells on its own. It requires insulin, which acts as a key to open the cell membrane. Insulin is released from the pancreas whenever food enters the body. After the liver converts nutrients from food into glucose, insulin transports glucose into cells within 2 hours. However, if food intake is frequent and excessive, insulin may begin to function improperly. As a result, glucose remains in the bloodstream instead of entering cells. This condition is called insulin resistance. If glucose remains in the bloodstream even after 2 hours following a meal due to insulin resistance, it is called diabetes. Excess glucose in the bloodstream damages blood vessels, making them stiff and causing inflammation. In response to inflammation, blood clots may form. The liver converts excess glucose in the bloodstream into fat for storage. This condition is known as fatty liver. Fatty liver is not just fat buildup around the liver. It fills the storage space within liver cells with fat. If fat fills the space where the liver should function, the liver cannot function properly, leading to deterioration. About 1 in every 100 people with fatty liver develops liver cancer. Even with excess glucose in the bloodstream, there may still be residual glucose. Excess glucose is excreted through urine. When glucose is excreted in urine, a urine test may indicate diabetes. Insulin is produced as needed by the pancreas, but in diabetes, insulin resistance prevents glucose from properly entering cells. With insulin resistance, glucose can only enter cells at 20% efficiency, so insulin injections are administered to raise efficiency to 100%. With increased glucose in the bloodstream, blood vessels begin to deteriorate and blood thickens. To compensate for thickening blood, the heart pumps harder. This results in hypertension. Diabetes, hypertension, and hyperlipidemia often occur together, leading to a condition called metabolic syndrome. There is no cure for metabolic syndrome. Medications prescribed at hospitals are not cures but rather provide relief from symptoms. Hypertension medication only lowers blood pressure. Diabetes medication only supplies insulin. Hyperlipidemia medication only lowers cholesterol levels. Proper exercise and intermittent fasting are currently the best treatment for metabolic syndrome. Humans should eat when hungry, i.e., fast. Failure to exercise regularly and frequent overeating can lead to heart failure and stroke through diabetes, hyperlipidemia, and hypertension. It is important to engage in regular exercise, such as moderate walking, practice daily fasting for about 12 hours, and consistently eat small meals to maintain health in old age. Intermittent fasting, and daily walking of 10,000 steps are the shortcuts to maintaining health.